Welcome to On the Beat, everyone. I'm Troy Thompson. Of course, I'm here with Dr. Richard Hurd of Gastroenterology Associates of Columbus. And today we're talking all about yeast. Welcome to the show, my friend. Nice to see you again.
Good to see you too, Troy.
You're looking dapper.
Well, thank you. I appreciate that.
You dressed up for me today.
Yeah, of course.
I
yes.
appreciate
Sometimes
that.
I try to do
All right, now, there's been a lot of conversation on social media when it comes to yeast. And I'm a little bit concerned about what it's all for. So can we start to begin with, what is yeast?
Yeast is a fungus that people can get. Any animal can get it, but and it's very common. It's everywhere.
But isn't it in food?
Yes, sometimes it's in food, but that's a different type of yeast. The yeast we're specifically talking about is Candida. That's the genus. So Candida albicans is the genus and species, but Candida is a common yeast.
Okay, so being a gastroenterologist, what are you seeing when it comes to yeast within the body?
Not a lot, and that's the point that I want to make. You know, it's all out there, and people all the time are, you know, you see these ads, buy my product and we'll get rid of yeast in your body that, you know, they claim that it's a common cause of fatigue and all these kind of vague symptoms, and people are really worried about that. So what I mostly want to say is that for most of the people out there, you don't have to worry about yeast. The people who have to worry about that are people who are immunocompromised, who might be on chemotherapy, maybe have HIV, may be chronically ill and their body is weak. In those instances, then yeast can become a problem.
Okay, so are we seeing some type of infection in our bodies?
Yeah.
Bloating, soreness? What's the story with our intestines?
Yeah, so when we diagnose yeast in people, they come to us and say, Doc, I'm having trouble swallowing. Whenever I swallow, it hurts, or food feels like it's slowing down. My mouth feels pasty, and even you can look in their mouth sometimes and see this oral thrush, we call that. This is a white film over the top of their tongue.
Oh.
And these are pretty, you know, significant things. It's not this subtle thing that, you know, it has been portrayed to be. And when we see that, we'll look down their throat, we'll take some biopsies, we'll officially diagnose them with this yeast, and we'll treat it with medicines that kill the
Okay,
yeast.
so it's not an operational...
No.
So it's like an antibiotic?
Yeah. It is like an antibiotic that kills them.
How worried should I be if I have these symptoms that you're talking about right now? Does it get worse over time if untreated?
It can get bad, you know, but it gets bad enough that people go, all right, now I can't deal with this anymore. I'm going to go in and see what can be done about it.
Well, doctor, I want to say to you, sometimes we have things go wrong with our body that we don't even know is going wrong.
Yeah.
Like I would never think to come and see you if I have a white film over my tongue, but I'm obsessive. I have this little scraper that I scrape my tongue with. I don't know why I do it, but someone told me one day I should. Is that normal? Like, I don't know.
Well, people do that. Yes, people do that too. That's no big deal, but that's probably not going to help this yeast. You know, again, remember the point of this discussion. It's to make you not worry about yeast so much as what is being portrayed out there these days. You know, if you are a cancer patient and you're on chemotherapy and you're having difficulty swallowing, it hurts when you swallow, you don't want to eat because it hurts, come see us, and you're probably your cancer doctor is going to refer you to us for that. And we deal with that frequently. But you know, for you, this is not an issue.
Yeah. It's just another issue I don't need to worry about. Is that what you're telling me?
That is exactly right. I'm trying to, sometimes, you know, we tell people what to worry about, and then we tell them, you know what, you can breathe. You don't have to worry about this.
You know, I'm my worst own enemy because I talk to people like you all the time, and I self-diagnose 24/7. Very quickly, when we take the antibiotics, how long does it take to work?
Generally 2 weeks.
All right. Appreciate you, buddy.
Yes, sir.
Always great information. If you want to find out more, there it all is up on the screen for you. Dr. Richard Hurd of Gastroenterology and Associates.